Like when I was introduced in the back, I'm Wes Johnson, Director of Diversity and Minority Outreach. I like to say that my job is raising awareness, addressing disparities, and learning concerns about Parkinson's disease in underserved communities. I went to Xavier University, graduated in 2020 with a degree in Gender and Diversity Studies. So some of this work we're doing was stuff I've done in past internships and gone to school for. So there's a lot of good work being done throughout all the counties in the metro, throughout the city, and we're gonna keep raising awareness as much as we can. And with that, I would like to introduce our next speaker, Valerie Bucek. Valerie Bucek will be talking about the importance of exercising your voice. Valerie Bucek is a speech and language pathologist who specializes in Parkinson's. She has worked at Encompass Health Rehabilitation Hospital of Harmarville since 1991. Her current role is speech therapy manager and coordinator of disease-specific specialty programs. Valerie has a bachelor's degree in speech pathology from Duquesne University and a Master of Arts in Communication Disorders from the University of Pittsburgh. She is also trained in Parkinson-specific treatment approaches, including Speak Loud, Delay the Disease, and LSVT Loud. Valerie is also an instructor and has presented information on communication, cognition, and swallowing to numerous support groups, professionals, and students. Everybody give it up for Valerie Bucek.
Thank you so much for the introduction, and I am so excited to be here. So glad to see everyone and to be able to talk to you about exercising your voice. Because the thing is that people think a lot about physical exercise, but they don't really think about the muscles that are involved in speech production. So the muscles, your lips, your tongue, your diaphragm, your vocal folds. And so I am going to start to tell you a little bit about that. I am technically challenged, so I am going to try to get this presentation up because is it there? I have to point it at this. Okay. Like I said, I'm technically challenged. The big green button. Oh, okay, there we go. Okay, there we go. All right, so as was mentioned, I work at Encompass Health Rehabilitation Hospital of Harmarville, and it is a freestanding rehabilitation hospital. We actually have 6 programs that are accredited for disease-specific care by the Joint Commission. We're located in Indiana Township, which is near Fox Chapel, and our Parkinson's disease program is one of our 6 programs. We have disease-specific certification in stroke, brain injury, spinal cord injury, diabetes, amputee, and of course our Parkinson's disease program. And the reason why I'm mentioning this is because many times people with Parkinson's disease don't realize that if they have something happen to them, like maybe they have COVID, maybe they have a fall, maybe they have some kind of setback or exacerbation, and they go to the hospital, and then when it's time to leave the hospital, which is so short now, they're not ready to go home. They need to be strengthened. And so sometimes people don't think of the fact that you could go to rehabilitation. So we have a program that is certified by the Joint Commission for Disease-Specific Care, and some of the aspects of that is that we offer neuro-focused comprehensive treatment, which is physical therapy, occupational therapy, and speech therapy. You'll be treated by a physician-directed interdisciplinary team approach, and we follow evidence-based clinical practice guidelines. The clinicians are trained in Parkinson's disease specialized treatment approaches, as was mentioned, the power moves, the LSVT, delay the disease, big and loud. And we also have certified registered rehabilitation nurses who can make sure the medication timing is seamless. we offer not just as an inpatient program, but we offer a live in-person support group that's affiliated with our Parkinson Foundation of Western Pennsylvania. And we also offer a program on Zoom called Power Plus that I see some of my participants here, so thank you for coming. Yes. We have 30 minutes of the power moves that my boss in the back there, Casey Rodak, does, and then I do 30 minutes of voice exercises, and I'm going to be demonstrating some of that in a few minutes. Okay, so I'm just going to briefly mention, just so you have the background so that why the exercise demonstration makes sense, is that neurons that produce the chemical called dopamine die or become impaired, and dopamine is the neurotransmitter that relays impulses from one neuron to the next for the planning and controlling of, this is the key word, automatic muscle movements. And by automatic muscle movements, we're talking about things like walking and talking. And you might think, oh, well, that's not automatic, but actually it is, because you're not really, when you're walking or talking, you're not thinking about telling those particular muscles to move in a certain way. You just think, okay, I want to take a step, or oh, I want to say something. So without enough dopamine, the automatic movements are disrupted. And 80% of the dopamine is lost by the time motor symptoms appear in Parkinson's. So besides the ability to adequately activate the automatic movements, Parkinson's disease is characterized by reduced amplitude of movements. So it's the smaller walking and the softer voice. And although Parkinson's is labeled as progressive and degenerative, we all know that Parkinson responds favorably to exercise. But many of you may not have thought about exercising your voice. Whoop. So I went too far. So to go back, the star? Red, thank you. Okay. So according to the Parkinson Voice Project, up to 90% of individuals diagnosed with Parkinson's disease are likely to develop speech disorders during the course of their illness, potentially seriously affecting their intelligibility. And intelligibility refers to how understandable someone's speech is. Hypokinetic dysarthria is the motor speech disorder that is most often associated with Parkinson's disease. So think about these symptoms: imprecise articulation, reduced vocal volume, a hoarse sounding vocal quality, frequent throat clearing, trailing off at the end of sentences, inconsistent production of voice, and having a monotone or monopitch. Attenuation is the key, because people with Parkinson's have a sensory deficit, and so they perceive that they're speaking louder than they are. You would not believe the number of people with Parkinson's that when I work with them, they tell me that their family member, wife, husband have a hearing loss. So that device that I have right there that's pictured, and I can show it to people in person later if somebody stops by to see me, because I did bring that. That is a sound level meter, and that is my #1 tool that I use when I work with people with Parkinson's disease that have difficulty with their voice. I'll have them come in and talk to me, and I'll have my sound level meter going, and it registers what the person's volume is, and it registers what my volume is. And typical volume when you're speaking in conversation is 70 to 75 decibels. Many times people with Parkinson's disease, when they'll be talking to me, they'll be speaking at maybe 55, but they think they're speaking at a normal volume. And so having that visual representation to provide feedback is very helpful. Now you may wonder, well, what could that do? How could that help me? But there are applications on your smartphone that are free that are called a sound level meter. And you can download that and it can help you monitor your volume. Okay, so The most popular evidence-based speech therapy treatment approaches focus on bringing some aspect of speech production under volitional control. So that grid just shows you the two most popular speech therapy approaches. Oh, excuse me. Oh, yeah, that's right. So it shows you the LSVT loud, which many people are familiar with, and LSVT stands for Lee Silverman Voice Therapy. It was one of the first evidence-based treatment approaches in speech therapy. Lee Silverman was a woman with Parkinson's disease, and she left her fortune to Parkinson's disease research. And what she did was it compared the different approaches to determine what aspect of speech production made the most difference. And what they found was that it was being louder. Speak out is the other approach that's listed. And that, that grid shows that they are both very similar. And just like POWER, Parkinson Wellness Recovery, developed from LSVT big, being a little bit less structured, Speak Out developed from LSVT loud. And so Speak Out is actually the approach that I'm going to demonstrate for you. So Speak Out is the evidence-based treatment approach that focuses on intent. It helps patients with Parkinson's disease regain and maintain their speaking abilities. And just as Jim had talked about earlier, it also uses the principles of motor learning and evidence-based neuroplasticity. So that picture is of Daniel Boone. And Daniel Boone wrote my voice textbook. And he later in life, became affiliated with the Parkinson Voice Project. And what he discovered in the 1950s was that when people are intentional with their speech, when they're deliberate, it addresses the disruption of automatic movements caused by the dopamine depletion. So when you speak with purpose and deliberation, you will improve your vocal volume and your speech clarity. And if you think for a minute about trying to do anything and paying attention to anything, this approach makes sense. Because if you're trying to lose weight and you pay attention to it, you're more likely to lose weight than if you don't pay attention to it, right? So that is sort of the basis of this. And that is just a slide that shows the components of the Speak Out program. Of course, there would be a speech evaluation with a speech pathologist, and the Parkinson Voice Project offers many resources online, including a Parkinson's information session for patients and family. Then you would do the Speak Out treatment, and that is followed by the loud crowd. And that is what makes Speak Out unique, is that it has a group therapy component that helps people maintain their new voice. So let's try to speak with intent, okay? So one of the aspects, one of the exercises that we're going to do is our warm-up syllables. And this is another reason why I am so happy that I have some of my people from my virtual exercise program here, because maybe you guys can take the lead, because we're going to demonstrate it. So what the warm-up syllables are, they are a nasal consonant with the vowel, and we are going to stretch out the vowels. So what we're going to say is we're going to say the may, me, my, mo, moo. And we don't want to sound like we're herding cats, so I'm going to stretch my arms out. I want you to do it with me, and I want you to hold that vowel while you're doing that. And what we want to do is we want to fill the room. And I will tell you that I want you to feel effort in your voice. I want you to take a good breath, and we're going to do this. So my people that are here, please do it along with me, okay? Here we go. May, me, my, mo, moo. And we take a breath. Think about how you're saying those sounds and really try to fill the room. Let's ratchet it up. May, me, my, mo, moo. Nice work. Take a breath. If you have water, take a sip and swallow hard. Okay, we're going to do one more. And think about, we're trying to hit 80, 85 decibels, okay? Feel that effort. Here we go. May, me, my, mo, moo. Excellent. Okay, our next exercise is the ah. It is called the sustained vowel. And the purpose of this exercise is to not allow your voice to fade. Many times people with Parkinson's disease have difficulty with their voice fading when they're talking. So you want to make sure that you're getting a good breath. And we're going to hold that ah for 10 seconds, okay? So it's going to sound like this. Ah. And I want good mouth opening. I want a good breath. And I want you to feel how it feels to speak with intent. Okay? So let's do it now. Ah. Nice job, but I think you can get a little bit better than that. Okay? So we want open mouths and a good breath. Here we go. Ah. And you might say, that feels like work. And yes, it's supposed to. Okay? So now we're going to do another exercise that we use the ah with. And this is called the pitch glide. This is probably one of the most difficult ones. It's the hardest one to teach. But it addresses the aspect of the monotone. So we are trying to exercise our voice to get some variation in the voice. So what we're going to do is we're going to say the ah, we're going to glide up the scale, and when we get to the top, we're going to get a breath and glide back down. And in order for us to do that, you know, it's sometimes a little bit difficult because you want to vary your pitch, but still keep being a good volume, okay? So we're going to do that now. It's like this. Ah, ah. Okay, so we're going to do it. Let me hear you. Ah, ah. That was excellent. Okay, let's do it again. Ah, ah. Okay, we're going to do one more. Ah, ah. Beautiful. Okay. So this next exercise is the counting exercise. And this exercise focuses on breath support because we're going to count and we're going to have a series of 3 numbers, and then we're going to stop and take a breath, and then we're going to continue to the next series. So we're going to count, today we're going to count from 1 to 12. When we're doing the program, many times as we go to the end of the month, we go with larger, longer, more multisyllabic words, which are harder to maintain your breath support saying. But I want you to think about how you're saying those number words. I want you to think about being intentional and articulate and trying to say each part of those number words clearly. And we're going to run the words together in a smooth, connected way. All right? So we're going to count now. It sort of starts like this. I'll give you an example. 1, 2, 3, 4, 5, 6. Okay, like that. So we're going to start over. We're going to do it now. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Great work. Let's do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Very intentional. Nice work. Okay, so another component of the Speak Out program is oral reading. And there has been a lot of research out there that's shown the importance of oral reading, not just for speech production, but also for cognition, of trying to do things orally and trying to think about how you're speaking and how you're saying those words. And so remember, we're not just reading the words, because what the focus is on Speak Out is on talking. So you want to say these things with expression. So I'm going to give you the example. It's like this. You would say, "Hi there." Let me hear you.
Hi there.
"Good morning."
Good morning.
"How are you?"
How are you?
"Who is calling?"
Who is calling?
"Come over here."
Come over here.
"I love you."
I love you.
"See you later."
See you later.
"I am working hard."
I am working hard.
"I am doing great."
I am doing great.
Speak out.
Speak out.
Great work. Okay, and then another aspect of the program involves what I call structured, spontaneous responses, right? So I would come up with something, an activity, and we're working on talking. It's sort of a bridge between reading and conversation. So I am going to say the beginning of something, and I am going to leave the last word out. I want you to finish it for me. If I would be doing this in my loud crowd, I call on people individually so that we can provide feedback. But in this setting, we're going to do it just as a group. So here we go. Up and down. Cream and sugar. Stop and go. I think you can be a little bit more intentional. Bacon and eggs. Hot and cold. You and me. Old and first and so we're dropping down the volume a little bit. Be more intentional. Paper and night and day. Nice job. Okay, so to round things up, speaking with intent means to focus, concentrate, be purposeful, be mindful. You're going to take control of your speech. You need to put forth conscious effort. Say it like you mean it. Ignore what feels natural or normal, because you really have to think about how you're talking, not just what you're saying, but how you're talking. Be deliberate. Some suggestions on how to be effective in your communication. You want to control your environment. So if you're talking to somebody that's important, about something important, turn off the television, because you don't want to have to talk over things. Look where you want your voice to go. Don't be looking down. Look at the person. Face your communication partner. Make eye contact. Make sure your body is in good alignment. If you think about it, people who talk for a living typically talk when they're standing up, right? So you might want to do the best you can to get your body in good alignment so your diaphragm isn't working so hard. This is the key one. You want to use your best speech all the time and exercise your voice every day. Not just for your speech, but also for your swallowing. So, I invite you all to practice with us. You can find us on the Parkinson Foundation website, and it's called Power Plus, and we're on Tuesday afternoons from 3 to 4. It's 30 minutes of physical exercise, led by Casey Rodak, and 30 minutes of voice exercise. And I also encourage you that you can find additional resources on the ParkinsonVoiceProject.org. they have daily opportunities for exercise. And I thank you very much for your kind attention.